Before providing oropharyngeal suctioning, perform hand hygiene. Ensure privacy. And introduce yourself to the patient. Then identify her using 2 identifiers.
Hello, my name's Erin. I'm going to be your nurse today.
Hi, Erin.
Can you go ahead and verify your full name and date of birth?
Sure. Karen Taylor, 9/10/47.
Thank you, Miss Taylor.
Apply a pulse oximeter to monitor her oxygen saturation level.
Get you set up a little.
Help the patient into a semi-Fowler's or sitting position. Assess for signs that the patient may require suctioning, such as restlessness, gurgling, drooling, ineffective coughing, gastric secretions, or vomitus in the mouth. Drape her neck and chest. Put on gloves and use a mask, gown, and face shield if splashing is likely. Fill a cup or basin with about 100 milliliters sterile water or sterile saline. Connect one end of the tubing to the suction machine and turn on the suction. Then connect the other end of the tubing to the Yankauer catheter. Verify that the suction mechanism is working properly by suctioning a small amount of sterile saline from the basin. If the patient has an oxygen mask, remove it, but keep it near her face. If she has a nasal cannula, leave it in place. Now insert the catheter into the patient's mouth, moving along the gum line toward the pharynx. Apply suction and move the catheter around the mouth until all secretions have been cleared. If the patient has an oxygen mask, replace it. Now suction water or normal saline through the catheter until the connecting tubing has been cleared of secretions. With the suction turned off, wash the patient's face if needed.
Here's a tissue for you.
Thank you.
Assess her respiratory status and repeat the suction procedure if necessary.
Feel like you're breathing a little bit better?
Yes, it's much better.
Your oxygen level's coming up nicely.
Good.
Then remove the drape and place it in the trash or laundry if it's soiled. If she has a diminished level of consciousness, help the patient into the Sims position to encourage drainage. Store the catheter in a clean, dry place. For example, in a bag attached to the bed rail.
Would you like to get repositioned?
Yes, please.
I'm going to go ahead and lower your head down.
Okay.
Help the patient into a comfortable position.
Let's go ahead and do some oral care and get your teeth brushed.
Okay.
And perform mouth care as needed. Discard the remaining water. Now remove your gloves and mask or face shield and dispose of them properly. Perform hand hygiene. Document the procedure, including how well the patient tolerated the suctioning. Note the amount, consistency, color, and odor of secretions.